Good evening, everybody. I would like to share a little bit about what Channel Degree has done for my parents. But of course, first thing is, it is God. It is only through God that all this has come about. Okay? Firstly, my father has been a high blood pressure patient for a very long time. But he has been active until he was about 71, when Louis recommended the crypto and ginkgo to him. When he started for a short while, and when he went for his regular tests to hospital for normal monthly checkups, they told him that his potassium level was rising. So he came back home and fired us saying that I'm not going to take this anymore because now my health is deteriorating. So when I told Louis and the late David, who was working with her, they immediately realized that something was wrong with his kidney. But of course, being a very stubborn man, he refused to believe anything. In May year 2000, he went into very acute renal failure and renal failure and also heart failure, and we nearly lost him. So he was rushed to hospital and he was in ICU for about 17 days. And prior to that, doctors had already said that they only give him 48 hours to decide whether he will pull through. By God's grace, he made it. And after about almost a month, he came out of hospital. Immediately, we started him on the crypto and ginkgo. With a little bit of advice, he decided to try it. And about 6 months after that, when we went for a holiday to Cameron's, and we had to delay his dialysis because he has to go on dialysis 3 times a week because of the fact that his kidneys already failed. So we had to delay his dialysis one day because of our holiday. And we were all very shocked to see that he had actually gone to the bathroom and urinated, because kidney patients do not urinate. And the only thing I could think of is it could be the crypto, and the crypto especially, because that has given him a little bit of strength. So he's doing well. By God's grace, he's doing well, and he will be 74 next month. He can walk about, he's mobile, he's just going for his normal 3 times a week for his dialysis, and he's taking the crypto as well as the ginkgo without fail. And in fact, he just told me this evening that his cholesterol level has gone up a little high, to check and see if he could increase on his dosage, which he never would have done 2 years ago. That is about my father. Okay? The next person is my mom, who was suddenly detected with colon cancer. Now, nobody knew that she was having it, and according to the doctors, it was about 10 months since it had got into her. And what happened is, when she just had a little bit of constipation for about 2-3 weeks, we decided to go and do some tests, and we found out about it. So, well, we did the surgery, and there were a little bit of metastasis spots in the liver and the nose. So what they said, the doctors said, is very hard to predict what exactly would take place. Probably 6 to 8 months, we don't know. But the part where it was infected in the colon was removed, and she's fine. That part of it is fine. So what they said is, they gave her a month's rest, and they said to come back to start her chemo. So immediately, I remember that I had a few friends who had taken this even when they had breast cancer, and also I contacted Madam Lewis, and she suggested that we try this. We've got nothing to lose by trying this this food rather. So we started her. First, we had to make her go on vegetarian. She's a person who enjoys any kind of food. She loves Chinese food, and it's very difficult for her to abstain. But we told her that that's the only way we can help her. So she immediately went into vegetarian. We started on vegetarian diet. We started on fruit juice diet recommended by my friends. And simultaneously, we gave her the CGF. Initially, she took 2 CGF a day with crypto and fiber and everything in a package. 1 month later, we went to hospital, and they said we're going to start on the chemo. So the first chemo, she was very low in hemoglobin because she's already vegetarian. She's not taking sufficient protein. So they had to give her a blood transfusion. So when I brought it to Lewis's attention, she suggested we increase the dosage of the crypto, which I increased to a higher dosage. And subsequently, when we went for the second chemo after a 2-week interval, the doctors themselves were very surprised because her hemoglobin level was very good, and she was fine. She didn't have any nausea, any side effects, nothing whatsoever compared to what most people have. She's now 60, she will be 65, so when she was detected, she was almost 64. So some of the young patients in the oncology ward was very surprised. Well, we kept on with the CGF and the crypto and the zinc and the fiber, and she carried on, and her cancer count from a 2-digit from 20 over, every 2 weeks when you come in for a blood test, it drops. It kept dropping until they say for a normal person it should be 3. It had gone to 1.1. Now before the 6, when she took the first 6 chemo, they decided to do an assessment, to do a CT scan, and the doctors were very happy with the results, saying that some metastases have shrunk and 1 or 2 have disappeared, which is a very good sign and very fast. And when I mentioned to Mr. Raymond, he also said it is working very fast. Well, I feel it's God's grace as well as the CGF and everything. And in fact, after the 1 month break, when she went back for a next blood test, her cancer count dropped further without chemo for a month. So what I can feel personally is it should be what we are taking, the food that we are taking, the CGF and whatnot. So she carried on. Many patients could not finish the cycle of chemo at all because, of course, they have adverse side effects, loss of appetite, and of course she was psychologically depressed, but we were there to motivate her. We were there to give her all the encouragement, and she never lost any weight throughout her full 12 cycle chemo. And she could eat well, only thing that towards the end she became a bit like the hair loss, which was also growing back towards the 9th or 10th chemo. And the last chemo was in October, which now she's going up for follow-up checkups, and she's doing well. And I feel that it is a grip, and she's still taking, she hasn't stopped, and I asked her to continue for as long as there is a need to. And she's very cooperative and very helpful in the sense that she's also listening and doing what we suggest. And now she's here with me, and thank God, because of God. Thank you so much.